This is LiveWell Talk on breast cancer screening. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. October is the first month to have full fall weather, but it's also Breast Cancer Awareness Month. And returning to the podcast today is Therese Michels, manager of St. Luke's Breast and Bone Health, to share with listeners on breast cancer screening and recommendations and anything else that may come up. Welcome back.
Yeah, thank you.
We'll start with what is a mammogram?
Mammogram, it's just a basic 4-image view x-ray of your breast, and it prevents, to find screening in breast cancer. It's probably the most effective way to find breast cancer, and it's a 15-minute quick exam.
And is it painful?
It does use compression, so
at minimum uncomfortable.
Uncomfortable, yes,
yeah,
but usually not painful.
Okay. And what age should women start to request that what age should their family physician or their gynecologist obstetrician say, you need to get a breast mammogram?
Well, it's definitely up to the provider because they know their patient's history best, but our guidelines through our department are 35 through 40, get your baseline, 40 and above every year. Now, if you have family history, it's dependent on what first degree relative has it and how far back were they diagnosed. So you could start possibly as young as 30 getting screening mams.
And yearly exams, self-exams, what age do they tell? Puberty? Is that when they tell women to do those? Or
for breast self-exams, yes.
Yeah.
Usually it is kind of right after puberty on up. We do have, and you can even search it online, there's ways to do a self-exam at home. A lot of patients that we have found to come in our office have found lumps like that, so we do encourage a self-exam at home monthly.
One of the myths that I think we should talk about is the woman that has some sort of mild trauma to the breast and then feels a lump and associates with the trauma when actuality was just coincidental, they just found it after they had the injury. I've heard that multiple times from patients.
Right.
And so that's always been interesting.
Yes.
I think cancer care in general has changed in the fact that it's always perplexed me how in the 1950s and 60s and before that, like people were like you don't want to mention you have cancer, like it was some sort of stigmata of evilness or something that where they would just almost be in denial. And now we have pink ribbons and pink shoes, and NFL has pink uniforms and etc. Have you seen that change in your career where people are more open to getting these exams and talking about this disease?
Absolutely. I can even use myself as an example. My generation, they talk more about it. The generations before, such as my mom and her mother, did not talk about those things. For instance, I had actually had a mom that was diagnosed at 42, and she did not tell us. She just kept it quiet.
Yeah.
The first thing that came to her mind was, well, I'm protecting you. I'm not telling you that way, because we were in college at that time. So she didn't want it to hurt our studies. That probably did not, for most people, and it didn't go well with us when we did find out, because, she only lived 2 years, so we didn't find out until later. A lot of moms, and rightfully so, think they're protecting their kids, when in actuality, they have to know this kind of information because it does affect them and their screenings down the road. And it also can affect on whether they should get genetic testing with that too as well.
Absolutely.
So I really highly advise, I know there's that sense of protection out there, but I would really highly advise for mothers and grandmothers to be honest with their families, because that kind of genetic testing down the road, when it comes more available, will be good for them to know.
I think that's so true, and I've even had, not necessarily breast cancer, but with elderly patients that had perhaps symptoms consistent with colon cancer, and they say, well, I've lived a full life, I don't want any workup, but you're like, well, we probably should do it for your family, so you can tell them, and they're 100% of the time they're like, oh, okay, I hadn't thought of it that way, okay, that's fine.
Right.
The other thing that I think that's unique about breast cancer among of all is it really affects everyone, because everyone has a mom. and that it just does. So it touches everyone. I think everyone knows someone that has breast cancer.
Right.
I mean, I think that's one thing. I mean, not everyone knows someone that has prostate cancer or lung cancer, but everyone knows someone that has breast cancer.
Right.
And so it is more transparent, and which is something that is important. Just with whether it's mental health or breast cancer, I think we're becoming a better society as far as talking about these issues and treating them as just a medical condition that needs to be treated and studied and supported.
I agree.
I've said on other podcasts, and I say this in private as well as public, that I'm really concerned about the influence the pandemic had on chronic medical conditions. The National Health Service in Great Britain has a study, and where they calculate the number of cancers that were missed based on their demographics and their population. Which they have a unique system because they're all in one essentially medical record, the whole country, so it's easy to study that. But in your experience, did a lot of people miss their mammogram appointments during the pandemic?
Oh, for sure. And part of that is partly due to the departments and the guidelines from ACR asking us to shut down. So we actually had to shut down screening for about almost 2 months. So when you shut down a screening center, what happens, and especially women that are busy, because most of them are working moms and are working women, is that you get out of that routine. You get out of that yearly routine to come and do your physical, to come and do your screenings, and then the life goes on, and I'll get to it, the famous I'll get to it, because I do that myself. And so yes, we did see, I think it was around a 40% decline, which is quite staggering. So the studies are still going on with that, with the effect of what the pandemic has done, but they are predicting that it's going to be pretty high as far as cancers being found in later stages, because your best bet is to find them small, because treatments are more big and a wide variety of where you can get better treated if it's found small. But people that are putting those off, those are going to be found in later stages. So the studies are still going on with that, but they
anecdotally, I was speaking to one of the surgeons in town about, we were talking about that hospital volume and how busy it was. And I said, part of it is certainly the influence of the COVID is pretty small. It's all these chronic medical conditions that are decompensated. And I attributed that to the shutdown and people suspended health care for 18 months. And he responded, he goes, now that you mention it, just the other day I was kind of thinking to myself that he was seeing cancers more advanced than he had previously.
Right.
And at first he was like coincidental, then he kind of reflected upon it. And I think there's a lot of surgeons out there and physicians that are seeing that in their patient population, where just people didn't get health care for 18 months. And if we could go back and do it again, I get that question a lot. I wouldn't shut down healthcare.
I agree.
I wouldn't.
Yeah.
I might, if you're at high risk or in a vulnerable population, may have made special arrangements to see you, but I would have just kept business as usual and everything else.
Yeah.
And I think there's a lot of people that feel that way.
Yeah, those things don't stop.
No,
Pandemic,
they don't.
I think we were under the influence that this was, I agree. Hindsight is always 20/20 when you don't know what's going to shake out with it. But
Yeah,
I would agree.
And it was our first pandemic, so we do get
That's
a little
kind of
credit.
true. Yeah.
So I'd like to think the last, but that's probably not the case.
Yeah.
One other clarification that I don't understand personally is, how does MRI imaging play into the whole mammogram process? I hear this breast MRI, et cetera. Can you tell me about that?
Breast MRI is an additional screening that is kind of added on top.
So you
of
start
the
with the
screening
mammogram and then...
Yeah.
Okay.
Yeah, because mammogram's basically the gold standard. I do get questions a lot about that from women. Should I start with breast ultrasound? Should I start with breast MRI? But screening mam detects the majority of things that can be found in the breast. Breast MRI is more used for, say, you have a higher breast density, and that's in about 40% of women, which is genetic. Another myth with that is, my size of breast. Well, they're small, so I don't have dense tissue. That's not necessarily true. It's based on genetics. It doesn't matter size. But when you get into the MRI, it's the high risk patients that have like a high family risk of breast cancer. They have high breast density. So it's used as an additional tool to mammography that kind of is a little more higher effect in finding those cancers that are hard to find when you have those added to yourself.
And is it like a standard MRI that does that, or is it special MRI that?
It's got a special, I don't know what they call those, little brace that, you lay on the table and your breast goes through this tube.
All right.
Yeah.
So
yeah.
it is not your standard
kind of a special.
MRI.
It's 30 minutes. It doesn't take very long, and it's pretty easy to do.
Cool. I've always wondered about that, so I'm glad you're able to answer that for me. How can listeners get a mammogram?
We do have 3 convenient locations in town, which makes it great because we kind of cover each area of Cedar Rapids. So we have southwest side, where Westdale, right by Menards, Marion location, and then we have PCI downtown. So they're all convenient. We do have walk-ins from 9 to 3 as long as you have a screening order. And every Monday we do a later night at the PCI location, so we try to make it as convenient as we can.
Yeah, that's nice.
Yeah.
I remember when my mom passed away, it was early in my practice, and we opened up, to get caught up in clinic, I opened up appointments till 10 p.m. for a week. And we kept doing it once a week because people were so grateful to have that opportunity for that convenience. So that's a big deal.
Yeah, it
It really is.
It is.
So, well, Therese, thanks again for joining me today. Once again, this is Therese Michels, manager of St. Luke's Breast and Bone Health. To schedule your mammogram, talk to your provider or call 319-369-7216. Breast and Bone also offers walk-in mammograms at 3 convenient locations, Monday through Friday, 9 a.m. to 3 p.m. with a doctor's order. And to my friends that are listening from LaSalle and Jeff, they'll say the west side's the best side. But being a northeast side kid, I disagree with that. But finally, if you've been diagnosed with breast cancer or any type of cancer, the Nassif Community Cancer Center is here for you. For more information about its extensive offerings, including genetic counseling and services for cancers, call 319-558-4876 or visit communitycancercenter.org. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe, and if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.